Is in Texas. Florida has quickly become the new epicenter of the pandemic. Officials adding more than 11,000 new cases there, bringing the statewide total to more than 320,000 cases.
Let's go to the front lines in Florida. Joining us right now, Dr. Bernard Ashby, a cardiologist in Miami. He's also the lead of the Florida State Committee to Protect Medicare. Doctor, last week we were seeing hospitals nearing critical capacity in some parts of the state. Is that still the case?
Unfortunately, that is still the case. First of all, thanks for having me. My hospital in particular, our ICU is at capacity. Several hospitals across the state, not just in Miami, their ICUs are at capacity. And there's many more that have 90% capacity. So we are actually concerned. We are in a all hands on deck type of scenario. And unfortunately, the virus itself is not being contained. So myself, my medical colleagues, were very concerned about our hospital's capacity at this particular point.
So you guys are at capacity. Give me a sense then, what does it look like in the emergency department there? And what happens if somebody comes in and they need to be in intensive care?
Well, that's the million-dollar question. So, we have mechanisms to reroute patients to hospitals that are able to accommodate them. But what I do worry about are folks who are, people of color. For instance, I actually can tell you a story about a patient of mine. His daughter got turned away, her and 3 of her friends, when they presented to the ER sick. And so these are stories that don't get told, but these are the things that happen within the healthcare system that, lead to the quote-unquote disparities. So at this particular juncture, I'm very, very concerned about what's going on in Florida. We're seeing many more stories of people who are not getting the adequate care. And I think that this is going to bear out later on when we see the disparity in the death rate in people of color, people who don't have adequate access to health care, and it's a real issue.
There's an 8 p.m. curfew right now in effect for Miami Beach's South Beach Entertainment District. So that means a lot of places can only offer delivery. There's no pickup right now. Do you think that will help curb the spread?
So we're back to this piecemeal approach, this reactionary approach. Doctors such as myself, other healthcare professionals have been calling for a proactive, strategic approach to dealing with this coronavirus. And what you're seeing now are reactionary measures like the mandate, like the calls for lockdown. If we actually did the work ahead of time and got out ahead of this, we would not be dealing with this currently. And unfortunately, our citizens of the state are paying for this with their lives and with their livelihoods.
That said, I mean, that's all in the past. We have the situation that we have now in Florida. So if you're talking with Mayor DeSantis or Governor DeSantis or the mayor of Miami right now, what would you tell them is the most vital thing?
So, well, it's not one particular thing. There's no particular silver bullet. However, we need to increase the usage of masks. The fact that we have limited mask usage in Miami-Dade County, where we just instituted mandates, is it truly a concern? So we need widespread usage, but we're actually looking at needing another lockdown, unfortunately. I don't want it. No one in our community wants it because obviously it hurts our economic interest. However, we have to put the public health interest over the immediate expedient economic interest currently. And therefore, I think that we need to head to a lockdown. That's really our only option at this point because the mitigation methods that we're doing right now are inadequate at best.
Doctor, before we let you go, we're remembering the life and the work of Congressman John Lewis today. You have a story about meeting the congressman in Washington, D.C. Will you tell us about that?
Yes. So my friend and myself, Dr. Alan Laval, he's a cardiologist as well. We were at the Capitol building in D.C., and we were there for a legislative conference. And we just happened to bump into Dr. John Lewis. And during our conversation, he invited us to his office. And during that time, he sat there and told us stories about the civil rights era. He actually got some pictures in from Bloody Sunday where you see him getting beat and bloody by the police officers during that march. And during the course of the conversation, he looked at us and told us that he was in awe of our accomplishments and the fact that we're healers. And, Dr. Raval and I looked at each other and said, we wouldn't be here if it weren't for you. This white coat that I'm wearing is because of Dr. Lewis and others like him who fought, rebelled, sacrificed to give me the opportunity to be here. So John Lewis has impacted my life in ways that I can't even imagine. And for me, my mandate is to pay it forward. And I'm going to continue to fight for my communities. I'm going to continue to fight against quote unquote healthcare disparities to basically allow every citizen in the United States to have equal rights to the pursuit of happiness and freedom as Americans.
Dr. Ashby, well said, and we want to thank you for all the work that you're doing right now there. Stay safe in Florida.
Thank you so much. Appreciate you.